Hello, everybody. Thank you for joining me on another episode of the Health Insurance Store podcast with me, your host, president and founder of the Health Insurance Store, Aaron Zolbrod. So glad you've joined us. Hope everybody's staying healthy, staying safe. Let's relax for a little bit and learn a little bit here about some Medicare. We're going to talk about Part B, who should enroll, who shouldn't. As we've been doing every week, we've been expounding and expanding, going into more details on the question that we're getting for my weekly columns that appear in both the Post-Gazette, Pittsburgh Post-Gazette, Mondays on page A2 and Tuesdays in the Tribune Review on page A7. If you'd like to see read archived columns, you can go to our website, www.getyourbestplan.com. If you want to call the office at any time, you have questions, you want to make an appointment, that number is 724-603-3403. But enough of that. Let's get right into the question from Tony. It's a question we hear all the time. I'm turning 65 soon. How do I know if I should take Medicare Part B or not? It is a question we get all the time. I realize I've written multiple columns on this topic, so if you've read enough columns that you understand it, you can turn off the podcast and go listen to some music. Maybe there's even a ball game planned by the time you listen to this. I sure hope so. I miss some sports, let me tell you. But again, I've written on this topic several times, but is by far the most common question myself and the other agents receive at the Health Insurance Store. And honestly, guys, it's one of the most important things you need to get right for those who are on Medicare or are going on Medicare for the first time. So Tony's question sounds very simple and straightforward, right? I wish I could give you a straightforward one-size-fits-all answer, but I can't. So what we're going to do is we're going to go into a couple different scenarios where one might want to opt out of Part B or take it, Part B, and enroll in a supplement or an Advantage plan. Okay, we're going to talk about that and get into some detail on that. Part B now costs $144.60 per month. So that will need to be factored into your decision. And listen, this is something else that's important that I didn't get into in the column. There is something called IRMA, Income Related Monthly Adjustment Amount. This is, I guess I would call a tax on people who make, I don't know, you might call them the upper middle class. I don't know how you'd want to classify them, but here it is. If you made more than $85,000 2 years ago as a single person, and if you made more than $170,000 as a married couple, and this is based on what's called your MAGI, your Modified Adjusted Gross Income, you are going to get taxed, penalized. Bottom line is pay more for your Medicare Part B. So people who are going to pay more for their Part B are probably more than likely going to want to opt out for the time being, because you could pay, people are paying up to as much as $500 a month for Part B, and those are people who are making, we're talking about married couples making $500,000. So, not that many people that we know of that are in that bracket, but we're meeting a lot of people, especially in Allegheny County, who are over that $85,000, that $175,000 threshold. That's the first thing that needs to be taken into account. Part B costs $144.60 a month. If you are taking Part B, it's my advice that no one should have Medicare A and B alone, okay? Medicare by itself has no limit on what you can be billed in a calendar year, which is called your MOOP, your maximum out of pocket. So you would also want to choose a supplement, which generally start at $90 a month, or an Advantage plan, which actually are available with zero premium. So again, Medicare, no limit. If you needed $150,000 worth of chemo, which would not be out of the ordinary, you would pay 20% of that cost with Medicare, which would be $30,000. With a supplement, you'd pay zero for that. With an Advantage plan, those have caps on what you can be billed in a year's time between $3,400 and $6,700 a year. So for a $0 premium Advantage plan, you could cap that. Most zero premium plans are $6,700, but that sure is better than paying $30,000 in that situation I just discussed. So let's move on here and talk about the person who very likely would want to opt out of Part B. If you or your spouse are still working at age 65, and your employer or your spouse's employer is picking up the tab for most or all of the cost of your plan, then you're almost certainly don't need to enroll in Part B. So if my employer is paying the full cost of my insurance, like I do for my employees, and my employees have a $1,000 or $1,500 deductible, which we have now, and then nothing else, they don't need to go out and pay $1,800 a year for Part B when their deductible is only $1,500. And that's just if they had Medicare only. Now, if they want to go out and buy a supplement, that's another around $100, $115 a month. There's no reason to go out and spend that money if your employer is paying that for you. If your employer is picking up 75%, again, probably a good chance you may want to opt out of Part B. Now, you may have heard that opting out of Part B will result in a penalty down the road if you don't take it when you're first eligible for Medicare. This is where we get this over-the-fence advice. Don't take over-the-fence advice, folks. That's what we mean by taking advice from your neighbor, from your cousin, from your aunt, from your sister. This also means sometimes don't even take that advice from your HR department, because I've often met people who've got the wrong advice from people you would think would in authoritarian positions who should know these types of things. Okay? Now, it's not necessarily the case if you have for your spouse. Now, a lot of times this is important. A lot of times a spouse of an employer will not be paid for, or will not be the premium won't be covered as much as the employee. So, for example, the employee might get paid their premium paid at 100%, but the employee's spouse the employer might only pay 50% of their premium or 25%. So often, again, it's best for the employee to stay on that plan and the employee's spouse to possibly opt into Part B, and again, the employee opt out. We're going to talk about that a little bit more here in a moment. So there's some factors that need to be considered when making this decision other than just the $144.60 that Medicare Part B costs. Number one, how much is being deducted from your paycheck to help pay for your plan? In other words, is your employer paying? If your premium's $1,000, which for a 65-year-old, that's about what it cost, is your employer picking up 75%, which means you're paying $250? Is the employer only paying 50%, which means your portion is $500? Okay, that's a huge difference then. Number two, what is your deductible, coinsurance, and your maximum out of pocket, your MOOP? So even if you're paying less than what Medicare costs, $144.60, going on Medicare may be the better option if you have a high deductible and maybe 10% or 20% coinsurance. So coinsurance is the percentage of the bill you have to pay after that deductible's been met. So example, our coverage here at work at the health insurance store, we have a $1,500 major medical deductible, and then once we've met that, we don't pay for anything. So again, if I had a quadruple bypass surgery, cardiac rehab, follow-up scans, follow-up doctor visits, and that all came to $90,000, the most I'm paying is $1,500, and then everything else is covered. However, there are plans where you could pay 20% after the deductible's been met, and if I had $50,000 worth of bills, I would pay 20% of that $50,000 up till that cap, up till that max out of pocket. That could be as high as $7,500. So that needs to be taken into account. So those people, okay, it's $150, but yeah, holy cow, if I get sick, I could pay $7,500 out of my pocket. So those people might want to rethink that. Okay, do I want to take that risk? I can save a little bit of money on premiums by opting out of Part B because I don't have to get a supplement, but do I want to risk paying $7,500 out of my pocket in the event that I had a heart attack, a stroke, diagnosed with cancer, or something of that nature? Be careful here, however. It's not always as simple as doing the math or basing your decision on your deductible. The most important consideration could be what your prescriptions will cost when you go on Medicare Part D prescription drug plans. Because guess what? Prescription drug plans all have what is known as the donut hole. And if you fall into a donut hole when you have Medicare, you can spend thousands of dollars out of your own pocket that you wouldn't pay with an employer plan, because employer plans don't have a donut hole. You just pay flat copays for medications, no matter how much dollars worth or retail worth of medication you've taken. With Medicare Part D plans, once you've exhausted $4,000 worth of retail medications, once you've received that much, you've got to start paying 25% of the cost of that medication out of your pocket, and that could add up. So that all needs to be factored in when you're making that decision. I've often advised people to remain on an employer plan even when it was $100 or more per month than what Medicare and a supplement or Medicare Advantage plan and a PPO would or a HMO or PPO cost. So if this all sounds confusing, which I know it is, I'm saying a lot of HMOs, PPOs, MOOP. I mean, it might make you want to say a lot of other four-letter words. Go ahead. I'm not listening. I can't hear you. If you want to cuss and scream, I get it. We hear that all the time. And just for the record, if you come into an appointment, you want to cuss and swear, that's fine with us, as long as we're allowed to cuss and swear back. Anyways, guys, if it sounds confusing, what I want you to do is I want you to get a copy of your summary of benefits, okay, and find out what you're paying for the plan at work. So the summary of benefits is going to tell you what your deductible is, how much your copays are for doctor visits, for blood work, for x-rays, for CAT scans, how much that your coinsurance, that's a percentage, the percentage of the bill after your deductible, 10, 20, 30%. Generally, you're looking at 10 or 20% with most employer plans. That's going to be the industry standard, but we want to know that, okay? If you find those and you want to show us those, if you can get us the copy of those and you can tell us how much you're paying for your plan, in about 5 minutes, I can tell you if you're going to be better off staying on your plan at work or going on to Medicare Part B and getting a supplement and a prescription drug plan. Let's talk about those who absolutely do not want to opt out of Part B. We talked a little bit on my last podcast. Those who think they don't need it because they're healthy. I've met a couple of those people. I've met a couple of crotchety old guys. I don't need that Medicare Part B. It's $145. I ain't paying it. I've talked to that guy before. Okay, don't do that. Please don't let your mom or dad do that. An ambulance ride, air ambulance ride, is $15,000. Okay, from Fayette County to Pittsburgh, it's $15,000, $18,000. You'd have to pay that all yourself. There's no 20% that you'd pay. You'd pay the whole $15,000. That's 8.5 years worth of Part B premiums. Okay, that's one air ambulance ride. We're not talking about an outpatient surgery, emergency room visit, all of that stuff. Please don't do that. Again, there's very few people that do it, but I've met them. Number two, if you were eligible for Medicare, if you are on an ACA plan, an Obamacare plan, and you're getting a subsidy, and your premiums are less than Part B, you can't not take Part B and keep your Obamacare plan. I've met people who have done that as well. You're not eligible for a subsidy when you're eligible for Medicare when you turn 65, and all the subsidy you'd be getting. So if you were getting $700 a month, which if your premium was under $150, you probably are, that's about $8,000 a year. You'd have to pay all that back once they caught up to you. Might take a year, might take 2 years, but they're going to catch you. So don't do that. Again, you can't keep an ACA plan, take a subsidy, and opt out of Part B because it's cheaper than Medicare. 3, those who are getting insurance from a company they retired from. This is what we talked about in our last podcast. We've got teachers who retire early. They get bought out. They get 7 years worth of insurance as part of an incentive package. Other people may get that as well. You get this great insurance when you retire. You got to be working in order to not pay a penalty for Part B. I understand, over the years we've met hundreds of retirees and others who got buyouts. They say this: why would I want to pay for Medicare Part B when I'm getting health insurance for nothing? Unfortunately, again, that's not how the government sees it. You must be working, quote unquote, working to avoid the consequences of not taking Part B when first eligible. Again, we've met plenty of people who ended up in a serious predicament by not enrolling in Part B at age 65. So not only did they face a stiff late enrollment penalty after their insurance ran out, but again, like we talked about in the last podcast, they also couldn't enroll in Part B for a year longer, and that either left them without coverage for outpatient medical services or forcing them to pay over $1,000 a month for COBRA or an AC plan. Again, neither situation is a good one to find yourself in. So here are a couple pieces of advice if you're like Tony, who asked the question and wondering what to do about Part B when you turn 65. Don't opt out of Part B before you talk to me or one of the other agents. I don't care if a representative at Social Security told you don't have to take Part B, or told you have to take, or did tell you had to take Part B, or if it was your brother or sister or your HR person. I'm telling you, all those scenarios, I've met people who got bad advice. They either took Part B and paid paid all that money for 5 or 6 years they didn't need to, or they didn't take Part B and then they faced a stiff penalty and forced to pay a ton of money for insurance for, 10, 12, 14 months. We can tell you over the phone in just a few minutes if opting out is a good idea and assure you that it won't result in any penalties, or if we feel like taking Part B may be a good choice for you, we can then set up an appointment for, again, a no-cost consultation to go over the pros and cons of taking Medicare and a supplement or Advantage plan. It's really, really simple, folks. Remember, now listen, this isn't a choice for a lot of people. If taking Part B is your best or your only choice, you also want to make sure you understand the differences between the two types of plans, Medicare Advantage and supplement. You can find some of that on previous podcasts. I'm actually going to go over that in much more detail here in our next podcast that you can catch next week. That will be on the website soon. I highly recommend you listen to that. There is nothing more important than understanding the differences between Advantage plans and supplements. Making the wrong choice could lead to years and years of costly medical bills. That's all I have for today, folks. If you want to call and ask questions about this podcast or any other podcast, a column you read, if you have random questions about Medicare, please feel free. You can email me personally. My email is Aaron, Aaron, at getyourbestplan.com, getyourbestplan.com. You can give us a call at 724-603-3403. That's 724-603-3403. You can follow us and like us on Facebook. Please do that. The Health Insurance Store. We have offices here in Fayette County, Pennsylvania, Connellsville. We have an office in Forest Hills in Allegheny County in the Pittsburgh area, and we also have an office in Erie, Pennsylvania. You can do business practically anywhere in the country. We are licensed now in 20 states. We're licensed all over Pennsylvania. If we can be of any help at all, right now we know obviously we can't meet people face-to-face until Governor Wolf gives us the green light or the green whatever he's doing. We're in the yellow phase right now. We can't do that, but we can still do business over the phone, via the internet, a Zoom meeting, a virtual appointment, through the mail. We're doing it for hundreds of people. Again, the COVID doesn't stop insurance from going on. We all need it. We all got to have Medicare. If you have questions, give us a call. We'd love to help you. And again, thanks for joining us. We hope that you tune in soon for our next Health Insurance Store podcast. Everybody stay healthy and be safe. Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the Health Insurance Store.